Now, the spread of the coronavirus is accelerating. Listen to what the World Health Organization has told us today.
In the last 24 hours, we had the most cases in a single day since the outbreak started. So far, 99% of the cases are in China, and 80% of cases in China are from Hubei province.
Well, the virus has killed 490 people, and there are more than 24,000 confirmed cases in China alone. Also, lots of elements to this story I want to bring you. Let's first of all focus on a cruise ship which has at least 10 people with the virus on board. It's docked in Yokohama in Tokyo. You can see it here, absolutely enormous, with 3,700 people on board, and all of the passengers and crew are now going to be quarantined for 2 weeks. Here's one of them.
We've got bottled water, but we've only had one hot drink that's been offered. The meals have completely changed. We are definitely no longer on a luxury cruise. It's just an extended 2-week cruise, but it's not going to be a luxury cruise. It's going to be like a floating prison.
Well, a second cruise ship is docked in Hong Kong. The passengers too will be held in quarantine for 2 weeks. Rupert Wingfield-Hayes is there.
The big cruise ship anchored across the harbour from me there is the World Dream. It has 3,600 people on board. It had sailed to Taiwan but was turned back because 3 people were suspected of having contracted the coronavirus. They've been sent back here. That ship is now being held here with everybody on board. We understand a number of people have been confirmed as having the virus. Meanwhile, here in Hong Kong, the government has today confirmed that it will start quarantining everybody who crosses the border from mainland China starting this weekend. Hong Kong residents included. They will be told to go home and stay at home for 14 days. And the Hong Kong chief executive has for the first time acknowledged that so-called community transmission of the coronavirus may have begun here in Hong Kong. That is because 3 new cases were confirmed today with people who had not been to mainland China and had no contact with people travelling from mainland China.
Well, China's health authorities are stepping up their efforts to quarantine people. They've now told 18 million people in the east of the country to stay at home. Meanwhile, in the city where this began, Wuhan, 11 public venues are now being turned into makeshift facilities to quarantine patients. Have a look at these pictures. This is an exhibition centre in Wuhan, but now, as you can see, it's housing around 2,000 beds. The only people who are being allowed to leave China are foreign nationals, and they're being quarantined in their respective countries. So here we have pictures from Russia, where people have just arrived in Siberia. They've been flown straight there. They'll stay in a facility and monitored for 2 weeks. They'll have had better times, I'm sure. Then these are pictures from El Salvador, where people have been returning home. They're being monitored at a local hospital in what's being called an isolation room. And then there are these pictures of Australian nationals arriving at Christmas Island. Now, this is an island 1,400 kilometres off the coast of mainland Australia. None of these people have been diagnosed with the virus, but they will still be quarantined for 2 weeks. Well, Christmas Island, you can see how far it is. Well, that's Wuhan on the map, but here's Christmas Island. You can see how far it is off the mainland of Australia. It's primarily known for its detention centre that's being used in the past to house people seeking asylum in Australia. And it's the choice as the destination for these people from Wuhan, which is causing upset. Australia's former Race Relations Commissioner says, yes, this is complex, but Australian citizens deserve better from this government. He quotes one citizen, the government wouldn't send its citizens to Christmas Island if those who were trapped in Wuhan were white Australians. Now, the government pushes back very firmly at any such suggestion. Here we have the Foreign Minister saying the plan is only founded on medical advice, and any suggestion otherwise I absolutely reject. Well, Daniel Wu Yang is one of the Australian nationals being evacuated. He posted this on TikTok before he left Wuhan.
This has been my 3rd week, closing into 4th week now, and I'll be leaving today. I think it'll be okay. It's the best that we can do in this situation, really. I think everyone would prefer to be taken to anywhere in Australia.
Now, we know some of the evacuees aren't happy with the conditions on Christmas Island. For example, they've been sharing pictures. There's a cockroach that one woman spotted in her bedroom. Others have been reporting other insect problems. We also have an image of some of the food that's being served. Some evacuees are complaining the quality of the meals is just not any good. The authorities, though, have a different perspective. This is a leaflet that was given to everyone being taken to Christmas Island. It says the food will be hygienic, as will the accommodation. Well, next we're going to hear from Jennifer Nuzzo, an expert on global health security. Here's her analysis on all of these different quarantine measures in all these different countries and whether they're helping.
I really worry about these approaches. I mean, I don't think that they're going to be effective at keeping the virus out of countries. I think that countries have to assume there may even be virus already circulating that they're not finding because they're only looking for it in people who have traveled from China. We know this epidemic has been going on for weeks before we even noticed it. So we have really no good sense of where in the world the virus is transmitting. But what we do know is that these measures can be incredibly disruptive. And I am particularly worried that when we target measures at China, we may do things like interrupt the supply of critical medical supplies. China is a major producer of this. They've taken drastic measures. I am worried about the stability of medical supply chains. I think rather than isolate China and sort of penalize it for being forthcoming about its cases, it's in every country's best interest to try to work with China and to help them get a handle on this epidemic and focus internally on efforts to mitigate the spread of the virus and to protect those who may be most vulnerable from it. We can take measures to change the speed with which it spreads, public health measures, coughing hygiene and isolating cases. Those are things that can reduce the amount of people who become infected. And deadly, in terms of less deadly, I mean, obviously it would be great to have medicines and vaccines. Those are probably a long way off. But traditional medical care is also going to be important. So we need to make sure that the hospitals and health clinics have all of the resources they need to treat severely ill patients and to help them recover from their infection.